All right. Good morning, Assalamualaikum, and good morning to 523 people who have scanned through the QR code in today's event. So we like to welcome everyone to this to our webinar on HPV immunization, leaving no one behind, eliminating cervical cancer in Malaysia. So we are thrilled to have all of you here today. And my name is Dr. Helmi. I'm from the Faculty of Medicine, and I will be your host for this session. And before we begin, I would like to express our gratitude for the National Cancer Society Malaysia for helping to organize this talk for us this morning. And this is actually a prequel to the what they call that to the vaccination drive which we are going to have next week from the 25th to 26th of July on Thursday and Friday. I think some of you may have already received the what do you call that the WhatsApp message and also posters through your phones, okay, and you may register to the link provided in that poster, okay. So for today, our admin will also send a link for the attendance and e-certificate for this morning's event. So it will be placed, or the links will be placed in the chat session of all three media that we have this morning through the Zoom, in our Zoom chat here, Facebook, and also through the YouTube link as well. That's for the certificate. And for UNIMA staff, please sign in the QR code if you haven't done so for the attendance. And for this morning's talk, I'm glad to announce that CPD points will be given, okay, to all attendees for this morning's talk. So the National Cancer Society Malaysia is the first charitable organization in Malaysia that provides three main services, namely education, treatment, and support for those suffering from cancer and the general public for over 5 decades. So we will get Dr. Rutashini to, for today's event, after Dr. Rutashini finishes her presentation, we will begin with the QA session. You are also welcome to give comments in the chat section during the presentation. Please submit your questions in the chat section at the bottom of your screen. Just to inform you, to warn everyone that Dr. Rutashini is unable to give specific medical advice. So please keep your question general in nature, all right? So you may ask question in the comment section or in our social media platform in Facebook and also YouTube, right? So yeah. So today we have, as I mentioned just now, we have a special guest with us, Dr. Rutashini Selvasingam, who will be sharing her invaluable insights on HPV immunization and its role in eliminating cervical cancer in Malaysia. So before we start further, let me introduce the speaker. Now, Dr. Rutashini is a dedicated medical doctor who graduated in 2015 from Indonesia. She completed her housemanship in Hospital Kuala Lumpur in 2017 and has since taken on various significant roles, including serving as a medical officer in charge of the tuberculosis and leprosy unit in Marudi, and as a district health officer managing 3 districts under the Miri division. Okay. From 2020 to 2022, Dr. Rutashini was at the forefront of managing the COVID-19 pandemic and the vaccination rollout in rural Sarawak. So she recently completed her Masters in Public Health MPH in 2023 and is now pursuing her doctorate in Public Health BRPH in University Malaya. So beside her professional role, she's also a passionate medical volunteer leading to the HPV immunization program for the state of Sarawak. And today, Dr. Rutashini will be discussing HPV immunization, leaving no one behind, eliminating cervical cancer in Malaysia. And this talk will cover significance of HPV, current statistics on cervical cancer in Malaysia, and also comprehensive HPV vaccination rollout plan for Sarawak for this current event. So without further ado, please join me in welcoming Dr. Rutashini Selvasingam to the floor, or to the webinar. All right, Dr. Rutashini, the floor is yours.
Good morning. Thank you, Dr. Hilmi. Thank you for the introduction. So as informed by Dr. Hilmi just now, I am Dr. Ruta, representative from the National Cancer Society Malaysia. Before that, please allow me to share my screen. Okay, can you all see my slides?
Yes.
Okay, thank you. So first of all, I would like to take this opportunity to thank Unima Sarawak for giving me this opportunity to actually share regarding our vaccination drive that currently the National Cancer Society Malaysia is conducting in the whole of Malaysia. So we are currently conducting this HPV vaccination drive for all the states in Malaysia with the theme of leaving no one behind, eliminating cervical cancer in Malaysia. So let me share a bit about what do we do. What does our organization do? So our organization, we actually offer three main services, which is educate, care, and support. For educate, we actually educate the public to minimize cancer in Malaysia by raising public awareness on the prevention, screening, and early detection of cancer through education. So as we know that cancer is usually detected at late stages. Patients usually come forward when they are already at stage 3, stage 4. So here we play an important role in educating people that, when you have signs and symptoms, you should come and seek treatment early. Next, we offer care. Care, we actually, what we do is that we increase access to cancer services in Malaysia by providing affordable as well as advanced screening and diagnostic facilities. So sometimes, as we know, due to the current congestion and the crowdedness in the government hospital, so our organization, we also do offer a lot of cancer detecting screening, such as we also can do HPV DNA. We also have ultrasound and mammogram at our center. If you look at the photo on the left, that is actually our National Cancer Office, which is located at behind HKL in Kuala Lumpur. And here we actually offer a lot of services, such as we can do mammogram, we can do ultrasound, we can do cancer markers, we can even run basic blood profiles, including cancer markers and other necessary blood profiles, such as thyroid levels and also urine FEME, IFOBT, and etc. And last, we actually offer the support service, which is to empower individuals and those affected with cancer to maintain the highest possible quality of life. So when we talk about cancer, we know that this brings to a very detrimental mental health effect when someone actually has cancer. And it's not only about the patient who's suffering from cancer, but it's also about the family members, accepting the situation and also coping through this very difficult time. So here in National Cancer Society, we offer support to the patient and also the family, hoping that they can pull through this tough time with a smooth journey. Okay, so next, we talk about the vaccine and also cervical cancer. So I would like to apologize. My slide is in Malay, but I would speak in English. So as we know that the cervical cancer is actually the cancer of the female reproductive system. And when we talk about cancer, what is cancer itself? So cancer is the cells where actually they grow with, without being able to be controlled, meaning they mushroom very rapidly. And this is where from the normal anatomy of the cervix, it actually becomes an abnormal. And when this cancer affects the cervical area, we call it cervical cancer. Similarly, we have cancer in different organs of the body. For example, we have cancer of the brain, cancer of the kidney, cancer of the liver, colon cancer, or we call it cancer usus, and various other cancers. But today our focus would be on the cervical cancer because we are going to talk about the HPV vaccination and how it will help in preventing cervical cancer. So if you look at the picture that I have shared here, the one on the left actually shows the normal cervix. So usually it is smooth in surface and somewhat pinkish in color. But when you have cancer cells at the cervical area, then you will see that, there is often bleeding, and then the surface looks very rough, and you will see various lesions on the surface of the cervical area. So how does cancer cells actually develop? So as we know, we like, let's say for us, as an individual, we are actually exposed to a lot of virus and bacteria out there, and one of it is the human papilloma virus. So prior to receiving this vaccine, uh, HPV vaccine can actually help to protect against the type of HPV that cause most cervical cancer. So under the HPV virus itself, we have various different strains. And there are two common strains that causes cervical cancer, which is actually protected by this vaccine that we are giving. Okay, so this for the HPV vaccine, for most people, their immune system will clear the infection by not developing into cancer. But in a lot of people, also this HPV infection can develop into cervical cancer. And when this is left untreated, the uncontrolled growth of abnormal cells in the cervical region will become the cervical cancer. So we actually, with the current advancement of medication and technology, we actually have a simple test to detect this cervical cancer. I will talk about it a bit later. So as we know, cervical cancer globally is the fourth most common cancer among women. And currently in Malaysia, cervical cancer is the third most common cancer in Malaysia. Of course, in women, the most common cancer ranking number one is the breast cancer. And globally, we can see that there are 604,000 new cases of cervical cancer detected in 2020. And this, we are talking about only 1 year, meaning in 2020. So in regards to cervical cancer, in the same year of 2020, there were 341,000 deaths, which means that is almost equivalent to half of the new cases detected for cervical cancer in the same year. And this contributes to 7.7% of the death, all cause of death in women. And 90% of the new cases or death in the year 2020 actually happens in the lower and middle income countries. So if you're wondering why it happens in the lower and middle income countries, of course, a lot of factors play an important role in this. For instance, number one would be the screening tool. So as we know, like in Malaysia itself, some of our geographic locations of our the where people live, you know, the rural area and all that, of course they have limitation in access to medical care, access to coming forward to seek screening or help when they develop symptoms. And we know that in a lot of also outskirt places, you know, there is limitation in cancer treatment. For instance, let's talk about Sarawak itself. So because I've worked in Marudi previously, like a lot of my rural places in Marudi, we do not have the capability to actually conduct a lot of different types of screening for cancer. We would still have to refer to the secondary hospital located in the town. And then there you talk about cost, you know, they have to find their transport, they have to come down, and this all incurs a lot of cost. And actually in Sarawak, currently our main center for treatment of cancer is still in Kuching, in Hospital Umum Sarawak. Therefore, when you talk about patients who are cancer, and you know they are coming from different divisions in Sarawak, they would then have to travel to Kuching in order to get the treatment. And that would, like I said just now, would incur a lot of costs. And you know, it is not easy, because cancer treatment, when you talk about it, like chemo and radiotherapy, it's not a one-off thing, like today I give you, tomorrow you recover. No, it's a long-term process. Therefore, this explains to why, you know, a lot of these new cases and that are actually detected in the lower and middle income countries. So as I mentioned just now, cancer cervix is the third most common cancer among women in Malaysia. And I won't be surprised if we were actually to climb up the ladder and even be the second most common cancer among women in Malaysia, as we look at the number of new cases detected are actually increasing year by year. But in regards to that, as highlighted in my slide, breast cancer is still the number one most common cancer among women, and are followed by the colorectal cancer. So as we see, when we talk about stages of cancer, we have 4 stages in cancer, and we always hope that, when patients come to us being detected with cancer, they would come in stage 1 or even stage 2, because then we could offer treatment that could actually have a good outcome. When 95% patients who come in stage 1 or stage 2 can actually have a good outcome of cancer treatment. But statistics shows otherwise, that about 41% of patients who are detected with cervical cancer actually come at the late stage, stage 3 and stage 4. So what happens when they come at late stage? So when you come at stage 3 or stage 4, then of course we can offer you all the treatment and everything that is available, but the outcome would not be as great as when you come at stage 1 and stage 2. These days, we really hope that, a lot of all these different types of cancer will be detected at an early stage, so that these patients will have a good outcome, and also, they can live a quality life compared to those coming at stage 3 and stage 4. But look at the statistics, a lot of patients cumulatively are coming at stage 3 and stage 4, which is almost 41%, which is almost reaching half of the cancer cases diagnosed with cervical cancer. Okay, so here, this is looking at the cervical cancer related death in the last 5 years. So here we can see that cancer cervix, as I mentioned just now, is detected at the stage 4, and a lot of cancer cases are detected across various different religion, whether it's the Malay, the Chinese, or the Indian. Although statistics shows that, it's highly detected among the Chinese, which is 73.8%, but cancer just does not differentiate between any religion, age group, or, any particular demographic. Anybody is susceptible or are able to develop cancer at any point of their life. Okay, so what are the signs and symptoms of cervical cancer? So usually, first there will be abnormal bleeding or abnormal discharge. Okay, so as for a woman, we know that sometimes we have discharge even when we are going to get our period and all that, we will have discharge. But a normal discharge would usually be white, clear in color, and will not have any odor. But if your discharge is, other than white color, let's say yellowish or greenish, and when you see there is odor, it is advisable for you to get it checked. Next, usually people will have bleeding after sexual intercourse, weight loss, loss of appetite, back pain, pelvic area pain, or swelling over one leg or both legs, and also bleeding or spotting after menopause. So these are some of the signs and symptoms that can be attributed to cervical cancer, but not necessarily all patients will present with all the symptoms that I have shown in my slides here. So if let's say you suddenly feel like you are having significant weight loss, unexplainable. So it's different when you are on exercise or you are on diet and then you are having weight loss. That is a different story. But let's say when you are just living your normal daily routine, and then suddenly you realize, despite having good appetite, eating well, but you are actually losing weight significantly. Okay, not necessarily just by the measured weight on the weighing scale, but also could be, you realize your pants is getting looser, or all your clothings are getting looser, then maybe you would want to come forward and probably seek advice from doctor to why this is happening. And all these other symptoms, especially bleeding, a lot of women sometimes abnormal bleeding. So what do we define as abnormal bleeding is that, let's say, for those who are in the reproductive age, who are still getting your period, so your usual routine, your usual menstrual is 5 to 7 days. This I'm just giving a hypothetical example. So let's say your period's about 5 to 7 days, and usually you change 2 to 3 pads a day. And subsequently, as you know, your period comes to the end, usually the number of pads change required a day would be lesser. But let's say you notice that in these first 2 days, suddenly you have very heavy bleeding, requiring you to change more number of pads than your usual number of pads that you have been changing, then that is a sign maybe you would want to come and seek for professional advice to why this is happening. And also, let's say uh, when you have your period, you have completed your period cycle, and then maybe a week later, you suddenly experience heavy bleeding again or any form of bleeding, then you would want to come and also seek professional advice to why this is happening. So a lot of times when a patient come forward, usually they always complain about abnormal bleeding. So you must understand what is abnormal bleeding. And sometimes what happens is a lot of patients just take it as, oh, this is just my period cycle, or this is just my I can observe first. Let me observe first. And then they will observe, and then probably it will also happen again in the subsequent month, and then there you go, you are delaying your time. So if you notice anything abnormal, not only about cervical cancer, yeah, in general, if you notice anything abnormal that is concerning for you about your health, then you should seek medical advice, whether it is at the government doctors or the private doctors. But you should seek medical advice if you realize that something is concerning about your health, because every individual only knows about their health. You know your body. So anything abnormal, only you will be able to know and to come forward and tell or seek professional advice. Okay, so when we talk about screening, how do we screen for cervical cancer? You know the symptoms, you know what cervical cancer is. So now how do we screen for cervical cancer? So cervical cancer has actually two ways that we can screen. So last time, traditionally, if we have people who have actually done screening before for cervical cancer, you do the traditional pap smear where you go to the clinic, and the doctors or the nurses would actually ask you to conduct a regular pap smear screening. And I think a lot of you know this photo that I've put on the left side of my slide. They call it the dark mouth, where they insert this and then they take the sample from the cervical area of for the women. So last time, so we do cervical cancer screening for 20 to 64 years old, and we do every year for the first 2 years, and then subsequently it will be followed by if the findings are normal, then we would do every 3 years. But again, this all pap smear results are reviewed by doctors. So if there's anything urgent or you will need to repeat it maybe in 6 months, or if there's any abnormality findings, it will be advised accordingly. Okay, so but moving forward, because technology has advanced, today we have this screening tool that we call HPV DNA. So HPV DNA, as you can see in the photo that I've shared on the right side of the slide, is a screening tool where we actually can give to patients and patients can do it themselves. So when I talk about cervical cancer screening, why a lot of people do not come forward is because they are very scared to do this pap smear test, and they feel it's very painful, it's very uncomfortable. And there are a lot of factors. If you have experience speaking to maybe your mom or anyone that you know who has actually done this pap smear screening previously, and if you ask them like why you don't want to go regularly, these are some of the reasons they will say, like it's very painful, it's uncomfortable, and then a lot of other reasons. But today we have this kit that we call HPV DNA, where a lot of patients can actually do the test themselves. So when you go to the clinic or you go to any NGO, for instance, the Rose Foundation or the LPPKN, they actually give out this HPV DNA. In fact, we NCSM also we do this HPV DNA test kit where patients can actually do the pap smear by themselves. Okay, there is instructions on the box, or even the nurses on the ground would explain to you how do you take the sample by yourself. And then you just have to send in the kit to us, and then we would send it to the lab to read the results of your pap smear. So there's two methods. One is the conventional pap smear, and one is now the new technology, or we call it the HPV DNA. So when we talk about various different cancers, so like the breast cancer for women, the easiest way to detect is by doing clinical breast examination. It's a very simple test where you just have to check your breast by yourself. And same like that, for cervical cancer, we have this pap smear or this HPV DNA, which is actually a very simple tool to detect cervical cancer in women, which is very helpful. And for instance, like for the breast examination, of course, the clinical breast examination is free of charge because you just have to do the examination yourself. But even this kit currently, we are a lot of organizations like us, we are also giving it for free because we would like to encourage women to actually screen for cervical cancer. A lot of times, women do not want to screen for cervical cancer because they are very scared. They are very scared of coming forward to the clinic because of maybe past experiences, or maybe they feel uncomfortable, which we totally understand. But today we have a kit that you can actually use to do it yourself at your own convenience. Just make sure that once you have done the test, then you have to give it back to us so that we can send it to the lab to be run for the results. So what are the other methods? So once your pap smear is actually, when your pap smear result comes back as positive, then we would actually have to proceed with other examinations, for instance, colposcopy or biopsy to confirm the diagnosis. So it's not necessarily just after pap smear, and then there's some abnormality findings, you are definitely towards cervical cancer. No, we will have to do subsequent tests to actually confirm whether it is cervical cancer. And some of the tests that I have listed out here, for instance, colposcopy or biopsy. So in many cases, biopsy is always the diagnostic, confirmatory diagnostic tool to diagnose various different types of cancer. So when you're diagnosed with this cancer, what treatment options do you have? So here we have radiotherapy, chemotherapy, and surgical. So of course, the mainstay of treatment would be surgical if we could remove that area, or remove the tissues in that area. But surgical itself comes with a lot of how do I say it? Like, in order for you to be eligible to undergo surgery, that will be decided by the specialists themselves, because certain stages of cervical cancer, we cannot directly do surgery first. We have to administer chemo or radiotherapy first. So that will entirely depend on the assessment by the specialists themselves. And definitely the other treatments for all cancers generally is the same, which is chemotherapy and radiotherapy. And we know that a lot of patients also struggle during this phase because chemotherapy is a very strong medication. And when it enters the body, it will actually cause like a lot of other effects where patients usually do not feel comfortable, and they tend to default our treatment. They tend to not come and, opt for other treatments such as traditional treatment. That is why I keep emphasizing that it is very important for us to detect cancer at an early stage, because different stages of cancer, there will be different treatments that will be administered. Okay, so this is the factors for cervical cancer that can be prevented. Cervical cancer, which is caused by human papilloma virus, that can be prevented. So we know that once you are exposed to the HPV virus itself, so it takes a certain period of time before it develops into uh, the cancer itself. So with the administration of this vaccine, this HPV vaccine, we hope that we can prevent this HPV virus from developing into cancer. And this HPV virus is actually, it offers protection almost 90% to a lot to the individuals out there. And definitely for cancer, we would want everybody to come for early detection. We call it early detection. So we want the cancer to be detected early. And of course, having a good, healthy lifestyle would help prevent not only cancer, but a lot of other diseases also. So now let's talk about the HPV vaccine itself. So we have this HPV vaccine that is developed to protect against different subtypes of HPV virus. So it will actually stimulate the immune system of the body to develop antibodies to fight this HPV virus. So this vaccine HPV is actually a vaccine of 0.5 mils, which will be injected via the intramuscular at the deltoid region. Okay, so if for those who have actually received our vaccine, maybe you have for Kuching, Miri, and for Kuching, Miri, and Bintulu, if you have walked into any of our vaccination centers that we've been having for the past 2-3 weeks, you probably would have received this vaccine, and you have seen how they would inject it over the left arm or the right arm, depending on which is your less dominant arm. Okay, so how does this vaccine works? Once it's injected in the body, like I explained just now, it will develop antibodies to fight the HPV virus. Okay, so there are different types of HPV vaccination available out there. So the first one, we talk about the Cervarix. Okay, so this Cervarix actually covers two types of HPV vaccination, which is the HPV 16 and 18. And then which is only eligible for females. Then we talk about the Gardasil 4. This is the vaccine that National Cancer Society is giving. Gardasil 4 actually covers 4 strains of the HPV virus, which is HPV 6, 11, 16, and 18. So HPV virus subtype 16 and 18 is the one that is known to cause cervical cancer in women. Okay, and also Gardasil vaccine is eligible for both male and female. And then we talk about the last type of vaccine, which is Gardasil 9, which is available in the market today. So Gardasil 9 actually covers for 9 different subtypes of HPV virus, and it is also eligible for both male and female. So in this different types of vaccine, Cervarix is a 2-dose vaccine, Gardasil 9 is a 3-dose vaccine, and Gardasil 4 is a 1-dose vaccine. So this Gardasil 9, if you see in the market, nobody gives Gardasil 9 for free, and 3 doses could cost up to 1,700 to 2,000. Maybe some of you have received this Gardasil 9 vaccine outside. So every individual dose you have to pay, and you have to come and receive the second and third dose in an interval of 2 months and 4 months from the first dose. And this would cost almost up to 1,700 to 2,000. If you take it under us, under the National Cancer Society, then it will be 1,500. However, Gardasil 4, on the other hand, is a single dose vaccine that currently we are offering for free to everyone aged 13 to 26 years old. And also for other age categories, we have certain conditions to be clarified or double checked before we could administer this vaccine to the categories out to other age groups out of the mentioned age group just now. But the limit of receiving this, the age limit for receiving this Gardasil 4 vaccine is 45 years old. So above 45 years old, we do not administer this vaccine. Actually, not only Gardasil 4, even other different types of vaccine, if after 45 years old, we do not administer, because after 45 years old, a lot of us are already exposed. Generally, after 26 years old, a lot of us are already exposed to this HPV virus. And study shows that after 45 years old, it does not offer any protection when you take these HPV vaccinations. So again, I'm emphasizing that from the National Cancer Society Malaysia, we are giving the Gardasil 4 vaccine. And the vaccine that is currently available in the market is the Gardasil 9 vaccine. Okay, so what are the indications, as I've mentioned all these just now? And definitely the main concern for a lot of people is the side effect of the vaccine itself. So the side effect of the vaccine, as you can see, it actually depends on every individual's body, because I cannot advise for every individual whether you will develop the side effect or not. That entirely depends on your body and its immune system. But there are some general mild side effects of vaccine. For instance, you feel a bit tired on the side where you on the hand or where you receive the vaccine, or you feel a bit feverish after receiving the vaccine, maybe on the day after you receive the vaccine, or even the next day. But a lot of people only settle down with these kind of symptoms. And as of today, as of the number of vaccines we have administered, we have not received any feedback of patients developing very severe symptoms. And of course, we would also be very careful when we administer this vaccine, especially this vaccine is entirely contraindicated in women who are pregnant. And also for those who had a severe allergy. When we talk about severe allergy, up to, anaphylactic reaction, meaning you had anaphylaxis reaction and then you had to be intubated, where they put the tube in your mouth, then we would not administer this vaccine. And actually, these are some general rules that are applicable for various different vaccines, not only the HPV, but generally, when you talk about side effects, it's only very mild side effects, such as feeling feverish and also feeling sore on the arm of the injection. But a lot of patients, but you can resume your activities as usual, and there is no what do we say, pantang. There is no restrictions after taking this vaccine, because as I've administered this vaccine in Sarawak over the past 2 weeks, so these are a lot of questions that people ask. Is there any pantang larang, or is there any restrictions? And what are the side effects? So there are no restrictions. You can resume your activity as usual. And most patients only feel sore or slightly feverish. And if you feel slightly feverish, please do take some Panadol and you will definitely feel better. Okay, so when you ask whether children should be vaccinated with this HPV, we talk about those 9 years old and above. So the WHO actually recommends that this vaccine is best given in those 9 to 14 years old. So as we know, any vaccine or anything we would want to give as early as possible, because we would like to protect the community as early as possible from preventing them from developing any form of disease. And when we talk about HPV, the WHO themselves has actually recommended that this vaccine can be given starting as early as 9 years old. We call this the golden period. If you could give them during the 9 to 14 years old, hopefully it can prevent them or protect them from developing cervical cancer. Why we want to give during this I call it the golden period, is because the immune system, the response of the immune system is stronger, and the vaccine is most effective when given at this age, before they are exposed to the HPV virus itself. Okay, so as I mentioned just now, some of the side effects of vaccine, pain or sore at the site of injection, fever. Some people develop headache. Some people feel nauseated, muscle pain, or some people feel a bit dizzy. Okay, but these are all mild side effects that can, once you rest it out, you should feel better. But a lot of people that I've vaccinated in Sarawak, based on my own experience, because I go to the ground myself. So many of them only complain of sore on the arm of injection, especially when the medication goes in, it's a bit painful. Then after that, they are okay. And a lot of them also complain some mild feeling feverish. So yeah, only these two. The rest, like headache, vomiting, muscle pain, or dizziness, I've not received any feedback regarding other symptoms, but the first two, yes. Okay, so when we talk about HPV vaccine, of course, there are different types of what do we call side effects. But as you can see, the most common side effect, 1 in 10, is what I've mentioned just now, the pain over the site of injection, and also feverish and feeling tired. And the worst side effect that we are worried, or if you are worried, is the anaphylactic reaction. And that is where we talk about severe allergic reaction to the body. But it is not as common because it's only 1 in 100,000 who have developed this anaphylactic reaction. So that's why we are very careful when we administer the vaccine. We will, of course, ask you at the registration counter whether you have history of severe allergy before, and we would not administer the vaccine if you have a history of anaphylactic reaction before. Okay, so other side effects are not as common. I mean, it happens only 1 in 100,000 or 1 in 1,000 population. But yes, the common side effects, as I've been mentioning multiple times, is the pain or sore at the arm, and also feeling a bit feverish or headache. But again, side effects is entirely dependent on individual's body. Some people do not even have any side effect post-vaccination. And a lot of concerns come regarding when people ask me about HPV vaccination. They also ask me because as we know, we just finished the COVID-19 pandemic, and then we, received COVID-19 vaccine. And yes, some had a lot of side effects from the COVID-19 vaccine. So a lot of people are very concerned about whether HPV vaccine would have similar side effects as the COVID-19 vaccine. So as I have also mentioned again, based on my experience on ground and feedback from various patients, various people who have actually received this vaccine, I've only received these two side effects of feeling sore at the site of injection and also feeling feverish. So if you're asking whether HPV vaccination is safe or not. So this HPV vaccination has gone through 15 years of research and, trials before it was rolled out in the market. So definitely this HPV vaccination is a safe vaccine that can be given to protect our people. Okay, so study shows that, with the HPV vaccination, you can actually see that a lot of the cancer cases detected the HPV virus infection, the 16 and 18, which would cause the cervical cancer. You can see a reduction in number, as reported by the WHO. And this HPV vaccine is actually offers full protection for 10 years. It doesn't reduce. But as we know, HPV vaccine is actually one single vaccine which offers lifelong protection. So if you have completed the vaccine before, if you have taken the vaccine, or you have been given a complete dose of vaccines, for example, if you have taken Gardasil 9, and if you have completed all 3 doses, then you do not have to take this vaccination again. Similarly, if you took the vaccine at us, which is the Gardasil 4 vaccine, then the vaccination, the Cervarix 2, then you would not have to take this vaccination again. Okay, so this vaccine is safe, and it really helps to protect the community from cancer, which is caused by the human papilloma virus, or the HPV. Currently, Kementerian Kesihatan, or our Ministry of Health, is also rolling out this vaccination for the school students, entirely focusing on the school cohort, because as I mentioned earlier, even in WHO, the golden period, the best would be to administer this vaccine at 9 to 14 years old, or in the age group of 13 to 26, which is why KKM, or the Ministry of Health, is rolling out this vaccination program in the schools. So the KKM program itself is they are vaccinating those 13 to 17 years old in the school. And they are also covering the school cohort. And here we, the National Cancer Society, we are covering those outside the school cohort, hoping that, we can protect more people from this human papilloma virus infection, which could lead to the developing of cervical cancer. So if you're wondering whether your daughter in the school has actually received this vaccine, those aged between to 13 to 17 years old, you can either ask them directly, because they should be aware that they have actually received this vaccine. And also the National Cancer Society, we are currently rolling out this vaccine, like I mentioned just now, all over Malaysia. And currently I'm leading for the state of Sarawak. We hope that, we could give this vaccine to protect all women and men out there from this HPV virus. So for this Gardasil 4, as I explained just now, is eligible for both men and women. So we are administering this vaccine to both men and women. But if you are already receiving this vaccine under the school KKM cohort, please continue to complete the doses of vaccine under the school administration itself. Because like I said, we are supplementing the KKM program to protect the community outside the age group, or outside the ones that are being administered or vaccinated by the Ministry of Health themselves. With that, I think that's all for my talk today. And yeah, again, coming back to our program, the HPV vaccine that we are doing with the team of leaving no one behind. Thank you.
All right, thank you, Dr. Rutha. Thank you for the very extensive talk. I hope that everyone can get from various information to educate yourself on the importance of HPV vaccination. There are a couple of questions which is being asked online, but let me get the ball rolling first. Okay. Now, you mentioned okay, a lot of the talk when I noticed the talk is about touching on HPV vaccination among ladies, because we talk about screening of cervical cancer, etc. And we know that, I mean, at certain point of your talk, you mentioned about Gardasil 9 being given to, Gardasil being given to both males and female. So my question is it important for men or for the male to actually know about HPV infection and vaccination?
So, thank you, doctor, for the question. So, yes, I do agree that I've been emphasizing a lot about female. And when we talk about HPV virus itself, it's a lot of it is attributed to the cervical cancer. But why is it important for male to know? So, this HPV, like I have mentioned just now, we have various different subtypes, and some of these subtypes can actually cause we call it genital warts in male. And this is why we would like to actually administer this vaccine for males also, because it can protect them from developing these genital warts. So these genital warts can be attributed to sexually transmitted infection, can be caused by sexually transmitted infection. So we would like to protect this male community from developing any sexually transmitted disease. Hopefully that with this, we can prevent the genital warts, which is common among male.
Okay. Yeah, I just want to. So basically, what Dr. Ruta mentioned is that sebenarnya apa nama? Let's stop. I just translate a bit of Malay so that it reaches more people. So
Oh, boleh,
basically,
boleh.
yeah, apa nama tu? So apa yang kita nak halang adalah ketuat, ya.
Yes,
Genital wart
yes.
ketuat yang boleh berlaku di kawasan-kawasan seperti bahagian anus, ke anus ataupun tempat dubur dan sebagainya, yang boleh disebabkan oleh apa nama tu jangkitan melalui hubungan seksual dan sebagainya lah. Alright, okay, right. So now you mentioned about the having the free kit testing for the HPV DNA kit, which is given free by, I think, the Cancer Society. So where can people or the mass or public members, they can actually look for those? How they can apply for those kit?
So for Sarawak, doctor, we actually have LPPKN.
Mm-hmm.
or Rose Foundation, who's actually also giving this HPV DNA. So, like for instance, when in Sarawak, we will work together with LPPKN or Rose Foundation to actually provide this HPV DNA kit. So if let's say Unimas moving forward would like to do health screening or any form of health like I say, health screening in your campus, then you can actually get LPPKN on board, and they would help to provide this HPV DNA kit for the females.
Okay, okay.
But
Mhm.
for LPPKN, doctor, they have a certain term and condition, as in the age group and all that, which need to be clarified with them who will be entitled for this HPV DNA lah, from the LPPKN and Rose Foundation. Usually
Okay.
for Sarawak, we also work hand in hand with them if we have any health screening program that we conduct in Sarawak itself.
Right. Okay. Thank you. Okay, now I've got a few questions coming in right now. All right.
Mm.
There's a question. Good morning, Dr. Rutashini from Zoom. We just want to clarify on behalf of her friend. She received Gardasil 4 on the 5th of July, and she said that the nurse informed her that she needs to get the second dose 4 months time around November. So based on your slide just now, right, Gardasil 4 said it's mentioned that it's one dose is enough. Is it? Is
Yeah,
it? Or is it how is it?
yeah. Yeah, okay. So,
Mm,
because I'm looking at the chat also. So,
yeah.
Dr. Shazrina, yes, it's a single dose vaccine. So, yeah, they would not have to take any other
Mm,
dose. And also to Dayang, uh, like I've mentioned just now, this is vaccine offers lifetime protection. So if you have completed before, then you would not have to take it again. But again, make sure that you are well versed that you have actually completed this vaccine, meaning you have evidence like vaccine card or record to show that you have actually completed this vaccination. If you're unsure, you lost your card, you don't even know what vaccine you received previously, whether it is really HPV or some other vaccine, because a lot of people, they also take influenza, they also take various other vaccines that are available in the market. So if you're unsure, then I would advise you to take again. Okay, to Aboy, if let's say
yeah.
you have ketuat, yes, you can still take the vaccine, but the vaccine cannot hilangkan the ketuat yang
Yeah.
ada dekat SIA, but it can offer protection. Okay, sorry if I campur a bit bahasa
It's okay.
Sarawak, Melayu.
That's good. It's
Okay.
okay. That's good. Yeah,
Yeah,
there's
so
one question. Yeah.
mm,
Any? Yeah,
so
the
yeah, mun
mm,
kita ambil vaksin tu, it prevents, tapi niasi dapat menghilangkan benda macam ketuat ya lah. That means what I'm trying to say is, let's say mun kita ada ketuat dan kita ambil vaksin tu, niasi akan mengecilkan ketuat kah, niasi akan tiba-tiba, secara ajaib ketuat ia hilang si lah. But nia akan offer protection so that in future kita si dapat benda tu lagi lah.
no more future ketuat. Okay. Right. That needs another treatment for ketuat if there's
Yes.
another treatment. Okay. There's another question here.
Mm.
Apa beza wanita yang dah kahwin dengan yang belum kahwin mengambil vaksin? Who needs the vaccine most?
Okay, so for the HPV vaccine itself, kami orang si ada membezakan wanita yang dah kahwin atau wanita yang belum kahwin lah. Okay, if you ask me, everyone needs to be protected. Semua perlu diprotect. Jadi everyone should take the vaccine. Mun kita dah kahwin kah, kita belum kahwin kah, it doesn't matter lah. So if you are a woman within the eligible age group as mentioned, you are advised to take the vaccine if you have not received it before.
Mm-hmm. Okay. But what about those who are more than 46 years old?
Yeah, so as I mentioned
Mm,
just now, doctor, for those above 45 years old, administering this vaccine does not offer any additional benefit.
yeah.
So that's why we do not give the vaccine to those 45 and 46 and above.
Okay. So I
Yeah.
think this one, the same question. I think
Mm.
I've taken 2 doses previously, but I missed the third one because I was pregnant at that time. Do I need repeat third dose again? There's no need, right?
So if let's say
Mm.
you are
Also,
previously you have taken Gardasil 9, 2 doses, and you have missed your third dose during the
ah,
pregnancy, then please go back to your doctor and seek for advice whether you if they would still give you the third dose. Because for Gardasil 9, it is a 3-dose vaccine to offer
okay,
the full protection. Yeah.
right, okay, okay. This just to meraihkan the question from Facebook Live. Good morning, doctor. Can cancer be detected through screening from the blood test? Thanks.
Okay,
Yeah.
so
Mm.
for thank you for the question for the one on Facebook. So different cancers, we have different screening tools. Okay, so like I mentioned just now, um for cervical cancer, the screening tool is the pap smear, and also the either pap smear or HPV DNA. That is the basic screening tool that we can do to detect cervical cancer. And if we talk about various different cancers, as you know, we have tumor markers levels that we can run. But even if those levels are high, we would need to proceed with a confirmatory testing. So it is not entirely diagnosed from a blood result itself.
Mm.
And like I
Okay.
mentioned, the
Mm.
best so we talk about female here. When I talk about breast cancer or cervical cancer, breast cancer, definitely it is good to do self breast examination and mammogram. And for cervical cancer, it is better to do HPV DNA or pap smear. And then from there, if any abnormality findings, we can proceed with the confirmatory test directly.
Okay. Right. All right. I hope that one everyone is clear with that. This is just a screening tool. Okay. It's not
Yeah.
confirmatory. If positive, it can still mean negative, but you need to confirm further with a diagnostic test, right? Okay. Yeah. Should we complete 3 doses of HPV vaccine? Yeah. I think this one we have already answered in that. Um. Okay. Now, how about someone who is HPV positive 18? Is she still need to get this HPV vaccine? Someone who is HPV, I think what she meant is he or she meant is that if someone who is positive for HPV, I'm not too sure whether the 18 is subvariant or not,
Yeah,
or
it
the
is.
age, does she still need to get this HPV vaccine?
Okay, so like I mentioned just now, this HPV vaccine, HPV itself, we have different subtypes. So when you're talking about only one strain, which is the HPV 18, right? So of
Mm.
course you would still need to take the vaccine because it can protect you from other different subtypes. As I mentioned just now, like Gardasil 9, it can protect against 9 different subtypes. And for Gardasil 4, it protects against 4 different subtypes. So if you have, even though you're positive for HPV 18, there's still, the 16 and the other 2 that it can protect you from. Yeah.
Yeah, right. Okay, there are more questions trickling in through the Zoom.
Oh, okay.
Okay, some tell me it's not advised for 46 and above to women or men. What if they are sexually active? Yeah, I think you would try to respond to that again, or
Yeah, so again, I would like to emphasize that
yeah,
it does not offer any additional benefit. So if you are sexually active 46 and above, please get your regular pap smear done.
so,
That is a very important advice. I would like to emphasize again, even though you have taken this HPV vaccination, pap smear must still be done. You cannot neglect doing pap smear because, like I say, any vaccination that we give out there, it offers prevention, but that doesn't mean that you will not develop the disease. You still have to do your basic screening, which is the pap smear.
yeah. So which is what I think Dr. Imam. I think Dr. Imam is a family medicine physician.
Mm-hmm.
Isn't it better to be vaccinated given pre-exposure? Yeah, that's the main aim actually.
Yeah, that is the main
Right?
aim, doctor, actually.
Okay. We assume that a lot of the, how to say, the youngsters are actually before marriage, they're not
Yes.
really active, right? But of course,
Yeah.
there are some youngsters today who are actually sexually active, but it still confers
Yeah.
benefit in that sense.
Yeah, and
Okay.
I just want to also
Mm,
emphasize that, do not feel shy to come forward and get this
mm,
vaccine, even if you're sexually active or, you have any high risk behavior. Do not feel shy to come and take this vaccine because at the registration counter, we do not ask this kind of questions. We would only screen important things such as whether you are pregnant or not, or whether you have had history of severe allergy reaction before. So please come forward and take, since we are actually giving you this vaccine for free. As far as I know, in the market, Gardasil 9, it will not be given for free.
yeah. Okay. True. All right. There's another question.
Mm.
Okay. I think I mean, for the interest of public, apakah possibility seseorang yang sudah ada cancer untuk mendapat cervical cancer?
Okay, so
Okay.
I think this question, if I understand this question correctly, if you have any other cancer, for instance, any other organs, cancer of the brain or any other cancer,
Mm,
cancer usus or anything, that
mm.
doesn't reduce your risk of developing other cancers. You can still develop other cancers depending on your lifestyle and your behavior.
Right.
Yeah.
Okay. I was seeing that this question, if someone who has got cervical cancer, is it possible to get vaccinated again?
I
Oh, I was,
think the
yeah,
question is about if you have
yeah.
other cancers,
Other
can you
cancer,
get
yeah,
cervical
yeah.
cancer? So yeah, so it's
Okay.
applicable same like other diseases. So lah, doesn't mean if you
Right,
have
right.
diabetic, you would not get hypertension like that.
Okay. Okay, that's good.
HPV or pap smear.
Huh?
Sorry, yeah,
Um,
Ashila, I think
I
I'm
think
understanding your question whether HPV vaccination
DN
is better or pap smear. So
or
we are,
HPV DNA.
oh, HPV DNA or pap smear. Okay, so like yeah, okay,
Yeah,
HPV
okay, okay,
DNA.
okay. Mm,
So here what we are trying to when I talk about HPV DNA and pap smear is it's just that more of the patients comfortable and doing the pap smear at your comfortableness lah. So HPV DNA is the kit where you can do it yourself. Because when we talk about why there is a low uptake of pap smear, why people do not come forward for screening, is because they always feel uncomfortable, they always feel pain, and they feel sometimes they feel shy and things like that. So this HPV DNA, with the advancement of technology, HPV DNA is something that you can do at your own convenience. So if you ask me really why we have these two screening tools, or it's because HPV DNA is something that you can do at your convenience. So to me, I would not advise on which one is better, but the most important thing is please get your pap smear done. I mean your screening done. Sorry, please get your screening done. Whether you do it the pap smear or the HPV DNA, please get the screening done. That is the most important message here.
yeah. It's one
Okay,
question coming. Yeah. Mm,
so yes, so as I mentioned just now, the age limit for this vaccine is 45 years old. Regardless you have done pap smear or not, you can take this vaccine. And another thing I would like to also emphasize, because I received these questions or this feedback also, so you don't have to do pap smear first in order to take this vaccine. You can just take this vaccine, but you have to continue with your regular pap smear screening. Like I mentioned, this is a vaccine is for prevention, but screening is very important, especially when you talk about, these days our lifestyle and behavior. So please make sure you get your pap smear done. But at our booth, our vaccination drive, we only administer the vaccine. We do not conduct a pap smear test there. If during pregnancy, other genital ward with no history active sexual, but then suddenly the genital wart disappear a month before delivery. Is it related to hormone pregnancy? Okay, Marcella. So for this, genital wart that happens during pregnancy, I would advise you to, seek medical advice lah, because, genital warts can happen in various places. And for
Yeah.
instance, like if it happens in the anal, sometimes it's being confused with hemorrhoid. So it is better for you to seek advice when you develop these genital warts. And
Yeah.
if you curious why it disappears 1 month before delivery, like I said, it is better for you to ask the doctor that is treating you lah, because first we have to know whether it is really genital wart or something else.
Right.
How if the student complete second dose of vaccine from KKM? Do we need Gardasil 9 again? Like I've mentioned before, if you have completed vaccination for HPV, any form of vaccine, whether it's the Cervarix given by the Ministry of Health, or whether it's the Gardasil 9 vaccine that is available in the market, you don't have to take this vaccine. It's a one-time vaccination which offers lifelong protection. So if you have taken, or if you are under the school cohort, you don't have to worry, because the school students are covered by the Ministry of Health for the vaccination drive, for the vaccination program.
Right. I think it's pretty clear.
Yeah.
Okay. Yeah. Is there any more question? Otherwise, we can um uh slowly end the session. Okay.
Yeah. If you have
I'm
any
yeah.
other questions or doubts or queries, then feel free to, on the vaccination day, you can ask me. I think the
Yeah.
one that is organized by Unimas, high likely I will be there.
Yeah.
Yeah. Good
So for
morning, Doctor.
everyone, yeah.
Sorry,
Is
there's
it
one more question.
right? Okay. Go ahead.
Good morning, doctor. You mentioned just now that Gardasil 4 is for both gender. Can we register our son for the vaccine drive? Because for the school cohort, they only give to female. Yes. So for those parents whom your son is studying in school, yes, please, you can come and take your vaccine with us. But for your female children, which is in the school, please proceed under the KKM vaccination drive. But yes, for your son, please, you're most welcome to come to our vaccination drive. But Dr. Hilmi, 25, 26, we
Yes, correct.
allow walk-in, right? Are we
Yeah,
opening
yeah,
up?
we allow walk-in, but I think it's
Okay.
better to get it registered in the
Yeah.
Google form as well, because at least you can estimate how many vaccines that
Yes.
you're gonna bring on that day. Yeah.
Yeah. So please
Mm.
register at the Google form. Doktor, untuk program vaksinasi HPV nanti just datang saja ke? Yes, we do accept walk-in, but in order to help us estimate the number of vaccine, it would be great if you could actually register under the Google form or link that Dr. Hilmi has distributed. Maybe Dr. Hilmi can share here
Yeah.
later.
Yep. I will share. I will share there again.
Yeah.
Uh,
So then please register, because the registration is to help us estimate the number of vaccines, because we are flying in from KL. But yes, we would not reject anyone who walk in unless the vaccine finish.
okay.
So just to also mention, this week we are having tomorrow and Thursday, we are having a vaccination drive in Hospital Cebu. Okay, so if you have any family members or relatives living in Cebu, they can come and take vaccine at Hospital Cebu, Dewan Seduan. The Dewan's name is Dewan Seduan, from 10 a.m. up till 5 p.m. And the same week, from Wednesday to Sunday, we are having vaccine in Miri, also 10 a.m. but up till 4 p.m. we are having in Miri for 5 days in UTC Miri. Okay, so just for there, we do not have any pre-registration, so you can just walk in.
Yeah.
But
You have any
again,
relatives in Miri or Cebu, please
yes,
alert them on those dates, and then they can just walk into those places that Dr. Ruta mentioned just now.
yeah.
Yeah.
So to
Yeah.
Ashila for the program on
Mm.
25 to 26, yes, the prime age, of course, we want those 13 to 26. But as I've mentioned just now, we also vaccinate as early as 9 up till 45 years old. You can just come or register, and on that day, we will just do some pre-screening at the site itself, at the registration, at the vaccination itself.
Okay. Right. I think 1 hour plus. It has been quite a
Yeah.
long period, long 1 hour. So, okay, thank you, Dr. Rutashini, for that insightful presentation. I think, and also all the participants for your engaging question and also participation in this talk today. So, special thank you again to Dr. Rutashini for sharing her knowledge and also her slide, very important information on HPV. I think it's quite underrated for HPV vaccination in the past few years. So this is a very good platform to actually promote the use of, protect our younger generations against cervical cancer. And one of the way is through HPV vaccination. So we hope that
Yes.
you found this seminar to be informative and also to be inspiring as well. So before we end, so I'd like you to remind you again. I'm going to put up the QR code again. I take note of all the what do you call that? I take note of all the manual registration as well. And also the take all we will re-enter or put up the QR. For the Google form for attendance and e-certification as well. All right. So
Sorry,
yeah.
before that, Doctor, I would like to also take
Yep.
this opportunity to thank Unimas for organizing this session, because I think other than just coming to Sarawak and administering the vaccine to people, it is also very important that we educate the people on the importance of HPV vaccination and the cervical cancer screening itself. And I think Unimas has actually taken a very good opportunity to, create this platform through Facebook Live and all to get people to actually understand regarding the importance of HPV vaccination. So I would like to take this opportunity from our organization to thank the organizers from Unimas for actually creating this platform for me to share, to educate the people in Sarawak regarding HPV vaccination and also cervical cancer. Thank you so
Okay.
much.
All right. Okay. Thank you very much, to the Ruth. Right. So we'll end the session here, but I'll leave the Zoom on for everyone to get the attendance done. All right. Thank you, Dr. Ruth. Yeah. Hope to see you next week. Okay.